Hello, everyone. Healthcare organizations operate in highly regulated environments where patient safety, compliance, and operational risks must be carefully managed. From clinical incidents to legal and regulatory exposure, risk management plays a critical role in protecting both patients and healthcare institutions. Professionals responsible for identifying, assessing, and mitigating these risks often pursue the Certified Professional in Healthcare Risk Management credential. Administered by the American Hospital Association Certification Center, the exam validates knowledge in areas such as risk identification, patient safety, claims management, and regulatory compliance. In this video, we'll review a few practice questions that highlight the types of topics covered on the exam. Let's begin. Question number 1. The due diligence process in acquisitions is undertaken to A. Reduce unanticipated costs and risks, support valuation and post-acquisition performance. B. Hide liabilities. C. Avoid reviewing contracts. D. Remove compliance requirements. Answer: A. Reduce unanticipated costs and risks, support valuation and post-acquisition performance. Explanation: due diligence is a structured risk identification and validation process used in mergers and acquisitions to understand clinical, legal, regulatory, operational, and financial exposures before closing. Objectives include discovering hidden liabilities, claims history, compliance gaps, credentialing issues, cybersecurity risks, validating revenue assumptions, assessing quality and safety maturity, and estimating integration costs. This informs valuation, including potential price adjustments, deal terms, representations, warranties, indemnities, and post-close priorities to improve performance and reduce adverse surprises. Risk management objectives include ensuring continuity of safe care during transition, aligning policies and governance, and preventing inherited regulatory violations or claims tail exposures. Question number 2. An HMO advertises it is the best, and its physicians can manage any illness injury. A patient relies on this and is injured. The patient might sue the HMO for A. Apparent agency, negligent misrepresentation, vicarious liability, depending on facts and jurisdiction. B. Only weather damage. C. Only EMTALA penalties. D. Only OSHA violations. Answer: A. Apparent agency, negligent misrepresentation, vicarious liability, depending on facts and jurisdiction. Explanation: marketing claims can create liability exposure when they reasonably induce reliance and the patient suffers harm. Depending on jurisdiction and facts, plaintiffs may allege apparent agency, belief that physicians acted as the HMO's agents, vicarious liability, negligent credentialing, or negligent misrepresentation, consumer protection claims if statements are misleading. Risk management objectives include reviewing public claims for accuracy, ensuring marketing does not overpromise clinical capability, and aligning network adequacy and credentialing with representations. Clear disclosures about independent contractors may help, but do not always defeat apparent agency claims. Controls include legal review of advertising, credentialing rigor, quality oversight, and complaint surveillance to detect mismatches between marketing and actual service capability. Question number 3. What is the voluntary relinquishment by the insurer or self-insurer of the right to recover from a third party? A. Waiver of subrogation. B. Coinsurance. C. Underwriting. D. Experience rating. Answer: A. Waiver of subrogation. Explanation: subrogation is the insurer's right to seek recovery from a responsible third party after paying a loss. A waiver of subrogation clause means the insurer or self-insured entity gives up that recovery right, usually to support business relationships and reduce litigation between contracting parties. Risk financing objectives include understanding when waivers are acceptable, balanced against increased retained loss, ensuring the waiver aligns with insurance policy endorsements, and preventing unintended coverage gaps. Poorly managed waivers can shift costs back onto the organization and complicate recovery efforts. Contracts should be reviewed to ensure the waiver is mutual when appropriate and consistent with the organization's risk appetite and insurance program. Question number 4. An original contract could contain A. Effective date, insurance requirements, and contract terms. B. Only a logo and slogan. C. Only verbal promises. D. Only a price estimate without scope. Answer: A. Effective date, insurance requirements, and contract terms. Explanation: healthcare contracting is a risk control tool. Core terms include effective date, scope, responsibilities, performance standards, indemnification, and insurance requirements. Limits, additional insured, notice of cancellation. Clear terms reduce disputes, clarify liability allocation, and strengthen compliance. HIPAA, BAAs, data security, subcontractor controls. Risk management objectives focus on preventing uninsured exposures and ensuring vendors meet safety, credentialing, and regulatory requirements, especially for clinical services, technology, and facility operations. Question number 5. Protecting outdoor air intakes can mitigate the risk of terrorists introducing airborne agents. Steps include: A. Relocate intakes higher. Establish a security zone. Add lighting and surveillance. B. Paint the intake vents a different color. C. Put a no trespassing sign only. D. Reduce HVAC maintenance. Answer: A. Relocate intakes higher. Establish a security zone. Add lighting and surveillance. Explanation: air intake protection is a facility security and safety engineering control to reduce vulnerability to intentional contamination. Elevating intakes reduces easy access. Security zones create standoff distance. Lighting and surveillance deter and improve detection. Risk management objectives emphasize layered physical security, access control, environmental design, monitoring, and emergency response planning. In healthcare operations, these measures support resilience and continuity of care, reducing risk of mass exposure events that can overwhelm clinical capacity and cause severe harm. Preparing for the Certified Professional in Healthcare Risk Management exam involves more than learning definitions. It requires understanding how risk management principles apply to real healthcare scenarios, from incident investigation to policy development and regulatory compliance. Working through the questions like these can help reinforce that understanding and make the exam format more familiar. Check out the link in the description to continue practicing more exam practice questions available on CertBoosters. Subscribe to the channel for more certification practice videos across healthcare, cybersecurity, cloud, and IT domains. Thanks for watching, and best of luck with your CPHRM exam preparation.